I'm sure we've all heard myths concerning fibroids. Today, I'm here to debunk those myths. If you want to find out more, please continue watching this video. This is Time with Dr. Adams.
Time with Dr. Adams.
Hi there, welcome to another episode of Time with Dr. Adams. This is my channel. My name is Dr. Saki. You can call me Dr. Adams. I see a lot of women with a lot of misconceptions about fibroids. So in this video, we are going to talk about myths and the facts concerning fibroids. Please, if you haven't subscribed yet, kindly do so. Like, share, comment. Yes, this is a fact. Research has shown that over 80% of women on this earth have fibroids, meaning you and I might have fibroids. But then they are more common in black women. Research has shown that more black women have fibroids than any other race on this planet Earth. We tend to get it earlier on in life. Our symptoms are more severe, are more terrible than any other race. And why is this so? We do not know. All we know is black women are more prone to getting fibroids than any other. This is not true. Whether you are a virgin or you are a mother, born 1, born 2, born 4, you can have fibroids. However, research has shown that women who are much older, after 40 years, are more prone to getting fibroids as compared to those who are younger. But it does not mean that if you have never given birth or you are a virgin, you cannot have fibroids. So far as the womb, the uterus is empty, something in there can grow, and that something can be It is not true. It is so hilarious to hear people say this. Please don't let any person, herbalist, deceive you that your fibroid is an accumulation of the blood, of your menstrual blood that could not come out. It is not true. Fibroid is a growth. If this is a muscle, fibroid is like a muscle. It's a growth that grows in your uterus. It is not your menstrual blood that has grown like that. Is not true. If anything, your pregnancy can grow together with your fibroid. Pregnancy is not a cure for fibroid. This is not true. After having your fibroid removed, so far as your uterus was not removed but just the fibroid, you can get pregnant again. This is so not true. Fibroids can become as big as babies. That one there is true, pa. I've seen a fibroid as big as a watermelon, but it cannot have hair on it because it is not a human being, but it can get as big as a baby or as water. I was in Koforidua once and I heard a herbalist advertising his product, that he gave it to a woman and her fibroid fell out of her vagina like a yam. I beg of you, this is, I don't know, say totally or if it's a joke, but he was really serious. I just couldn't believe it. Please, fibroids cannot fall out of your uterus through your vagina outside, because if it does, then you will bleed to death. Fibroids is connected to your tissue. It has so many blood vessels that it cannot fall on its own. Oh, please don't let anyone deceive you. If you have an issue, just go to the hospital to be sorted out. Yes, this is so true. After having your fibroids removed, it can definitely grow back. So far as your uterus is there, your fibroid can grow back. If you have a fibroid, you can go about your daily duties like nothing is happening, especially for patients who are not having symptoms. Me, for example, me. Yes, when I was pregnant, I found out that I had fibroids. Now, I'm not having any symptoms. My tummy, this is my tummy after one child. I'm not getting big. I do not have any symptoms at all. So I'm living my normal, perfect life. I do not even have menstrual I do not even have menstrual pain as I used to before. Now I'm just living a normal life because though I have fibroids, I am asymptomatic, meaning I do not have. Your fibroid is removed. No, your internal organs are perfectly safe. So far as the uterus is there, then everything is fine. Other methods of managing fibroids. Remember, there's only one cure for fibroid, and you want to know, continue watching this video. Yes, fibroids can cause you to lose your uterus. Why? There's an operation we call hysterectomy, and this is the only cure for fibroids. The fibroids will disappear from your life. Why? Because fibroids grow in the uterus. So when we do hysterectomy, we remove your uterus. So if there are if you do not have a uterus, it means the fibroids cannot grow in there. So yes, a fibroid can make you lose your uterus should you have that operation that we call hysterectomy. Yes and no, it depends on your explanation. Fibroids cannot diminish or disappear when you get to your menopause. However, it begins to shrink. Why does it do so? Please continue watching this video and I will explain. Yes, and the answer is me. When I was pregnant, we found out that I had fibroid. I gave birth through my vagina. Yes, my baby. Her name is Boss Baby. Have you seen her? She came out from my vagina without any operation. In fact, I had a very lovely and enjoyable delivery. No complications at all. Yes, still, I have fibroids. So all you need to do is to go to the hospital and be managed appropriately. So then, after I've debunked all these myths, one may ask, what then is a fibroid? Fibroid is a non-cancerous growth in the uterus, as it can be found in a lot of places. Depending on where it is, we give it a name. It can be called subserosa, intramural, submucosa. It can be pedunculated. It can be found in the cervix. Now, if your fibroid can be found in your cervix, it means you cannot have birth or you cannot deliver through your vagina. So it always depends on where the fibroid is, the size, and the symptoms you are having. Someone might ask, what is the cause of fibroids? Fibroids currently doesn't have any cause. However, we have what we call risk factors. Risk factors mean if you check one of these factors and you think you have them, then the probability of you getting fibroid is high. For example, I'm a black woman, you probably watching might not be a black woman. So meaning you and I, between you and I have the risk factor of getting fibroid because I am black. Okay, another risk factor is family history. My mom has fibroid. When she got into menopause, the fibroid shrank. However, it's still there. So me having fibroid is not magical or it's not unexplanatory because it is hereditary. So if someone in your family has it, then there's a possibility. It doesn't mean you will also get, but there is a possibility of you getting. Women who are obese, this is also a risk factor for getting fibroids. Oral contraceptives, smoking, drinking alcohol are all risk factors of getting fibroids. What are some of the signs and symptoms? Heavy menstrual bleeding. Now, when we say heavy menstrual bleeding, before you used to have 3 to 4 days or let's say 5 to 7 days of bleeding. Then suddenly you are bleeding more than 7 days. It is very heavy. You change lots of pads in a day, maybe 3 to 5 pads in a day, and you are bleeding with clots. Please, this is a sign to show you that something is not well. Please run to the hospital. Go see your doctor and get a good diagnosis or be diagnosed appropriately. Do not sit at home with this. People who have fibroids can have constipation or urinating frequently, because the uterus is situated between the bladder. The bladder is where your urine comes from, and your rectum. Your rectum is where your poo-poo comes from. So depending on where the fibroid is, if it's more to the side of the bladder, it means you'll be urinating frequently. If the fibroid is more to the side of the rectum, it means it's pressing on the rectum and you might have constipation. Fibroids, when it is growing big, can also make your tummy look big. Probably you are not pregnant, but then people will be asking you, Charlie, are you 4 months pregnant? Are you 5 months pregnant? Because the fibroid is growing. You can also have lower abdominal pain, especially when you are menstruating. It can also cause infertility. Yes, if this is your womb and your fibroid is taking more than half of the space in your womb, of course, then a baby cannot adequately grow in there. So it can definitely cause a lot of miscarriages and even infertility. But with that said, have people carried babies to term even though they have fibroids? Yes, I personally know a lot of people. A church member of mine has given birth to 3 children even though she has fibroid. During her first pregnancy, the doctor was so good, was able to remove the fibroid, the first fibroid. It was as big as this, and the baby too was there. But with some people, they will not be able to carry the pregnancy and the fibroid to term. So your doctor will help you only if you go to the hospital. Now let me tell you, fibroid loves hormones. So as the baby is growing, and should you have a fibroid by its side, the baby and the fibroids will both be feeding on these hormones, and fibroid loves blood as well. So it will be feeding on the blood. Baby is taking blood, fibroid is also taking blood. Now remember, I said one of the myths was that when you get to menopause, the fibroid will diminish. It won't diminish, it will shrink, because any woman who is menopausal, it means that the woman doesn't have estrogen and progesterone. So far as you do not have these hormones, the fibroid will just be there small and will be shrinking. That's an example of my mom. She found out she had fibroid in her late 40s. When she went to see the gynecologist told her to just monitor because she was almost to her menopausal age. So they didn't do anything, they just observed. But remember, she went to the hospital first. I have lots of people writing to me in my DM asking me, Doc, my fibroid is 12 cm, is doing this, is making me bleed. And all I say, the answer I'll keep giving them is, please go to the hospital, because your doctor, your gynecologist will be best person to handle you appropriately. Do not be afraid. Is there something to be scared of? Of course, if you're having symptoms, fibroids can be very dangerous unless you are asymptomatic. And then again, I use myself as an example, because here I am not having any symptoms, and though I had fibroid whilst I was pregnant, it's probably there. I haven't checked, but I'm not having any symptoms. That's the underlying thing. I'm not having any symptoms. Then again, look at my tummy. You wouldn't know if I hadn't told you. But if you are having symptoms, I cannot overemphasize this. Heavy menstrual bleeding, you're having pain, you are always anemic, you are urinating often, you are constipated, your figure, you look pregnant, and all these things, please go to the hospital. Now, how do we diagnose fibroid? Apart from the symptoms that you probably might be having, when you go to the hospital, the doctor will examine you. I personally have felt a fibroid that was as big as this. Apart from personal examination or physical examination, we will do what we call an ultrasound to find out where the fibroid is, what type of fibroid, the location, the size, and if something else is happening more. So how do we manage fibroids? I use the word management because there's only one cure for fibroid, which I've already told you, and I'll repeat again. So we manage people with fibroids symptomatically. For example, if you are bleeding a lot and you become anemic, that is because you are bleeding, your blood level has come down, we will give you blood tonic to boost it. If you are having severe lower abdominal pain because of the fibroids, we will give you adequate painkillers to solve this. But there are some people whose bleeding is too much. They keep on bleeding and bleeding and bleeding. We take it a step further and put them on hormonal therapy. We can put them on oral contraceptives to help with the fibroid. Please, don't stay at home and start taking oral contraceptives yourself, because we monitor them. There's a way we give these oral contraceptives to help with the bleeding of this patient. So don't stay at home and take these medication yourself. We can also put them on some injections. Some people, we can even put them on IUD. There is also what we call uterine artery embolization. In this procedure, we go into the womb, or where the vascularization of the womb is. We look for the arteries that are feeding the fibroid, because I told you the fibroid loves blood. So when we find these vessels, we inject something into it to seize the blood flow. And if the fibroid isn't getting blood, it will start to shrink. And then finally, we have the operation. Operation isn't the only management. Like I've already spoken about this hormonal therapy, we also have the surgical procedure, and that is operation. Myomectomy is when we just take out the fibroid. I repeat, we just take out the fibroid from where it is located in or on your uterus, and then we stitch it up and your uterus is intact. This is done for people who still have intention of giving birth. For example, maybe you are in your early 20s, you haven't given birth before, but then your fibroid is really huge and it's giving you issues, it's making you have other complications. Then we will take it out, so just the fibroid. However, if you're an elderly woman, or even if you're in your late 30s or somewhere in your 40s, and you think you have finished giving birth, we can take your womb out completely, and that is what is called hysterectomy. This is done for women who have no intentions of giving birth again. This discussion you are supposed to have with your gynecologist, because they will know what is best for you. You tell them your consent and they'll give you the options to choose from. If you have any questions, please let me know in the comment section below. If there's any topic you want me to cover, please let me know in the comment section below. And like I always say, please subscribe, like, share, and comment. And remember, let's be kind to each other, because still, yes, official.
Time with Dr.